Hi everyone, this is Dr. Ko from 01 Plastic Surgery Clinic. Today I'll be talking about secondary eye surgeries. Now, it's best for the surgeon and the patient to achieve what we want after surgery, but sometimes the results may not be up to our expectations. And I think one of the main reasons that people want to have revision eye surgeries would be, number one, the line has become loose over time. Number two, the fold is too thick, what we call sausage eyes. And number three, the shape is unsatisfactory, meaning it may be more, or it may be too thin than you wanted, or there could be some asymmetry between the left and the right eye. So today I'll be covering each of these reasons with some sample photos. So if you look here, these patients, they all had previous surgeries, but their fold has become loose over time and they wanted to recreate a double eyelid crease. The skin on the upper eyelid, they were not too droopy or they were not too thick, so I went ahead with a non-incisional surgery. And for both of them, I also underwent ptosis correction as well. Now, ptosis correction literally would give your eyes a little bit more opening, thereby giving you the image of a subtle but bigger and brighter eye opening appearance. So if you look here, this next patient, she came for a revisional surgery. She had a previous incisional eye surgery. Now, as you can see, she has quite some asymmetry between the both eyes, and she also had difficulty in left eye opening. So I went with an incisional surgery, ptosis correction, and a medial epicantoplasty for her. The left eye, during the surgery, I noticed that the muscles responsible for eye opening were detached from their original locations. So I had to reattach them. And this photo is taken a month from the surgery, and you can see that the symmetry is still well maintained. The next patients, now you see three patients. These all had previous surgeries, but they all wanted to lower their crease because they felt it was a bit too high for them. And usually for these cases, an incisional method is required to manually lower the previous high set fold. And there are a couple things that I need to consider. One, or actually the only single most important factor would be, is there enough skin left on the upper eyelid? Because if there is, then I can simply remove the old scar while lowering the crease. But if there's not that much skin left, then I have to simply create a crease below the pre-existing fold. Now, if that happens, there's going to be a single crease when you open your eyes, but when you close them, you'll probably still see two scars. So again, these two patients on the top, they had enough skin laxity available on the upper eyelid, so I was able to remove the previous scar while lowering their folds. Now, the third patient, she did not have enough skin though, so I had to create a new scar below the previous crease. And all three of them underwent ptosis correction as well. Ptosis correction, as I mentioned before, they help you to gain bigger, brighter eye opening, and especially in these cases, they help me to get the subsequent lower crease that we want. And finally, these patients, they all had their previous surgeries done, and the fold weren't loose or anything, but they just wanted to have a bigger crease. And these two patients, they did not have that much skin dripping or too thick of a skin, so I went with a non-incisional method for them. The first one also underwent a lateral cantoplasty and lowered the lowering procedure to have a slightly more enlarged eyes in the outer portion. The second patient underwent a medial upper oblique, to be more exact, medial epicantoplasty, so that we can still see the crease visible in the inner corners as well. So technically, any revisional surgeries, whether it be eyes or nose, it's best to wait 5 or 6 months after the previous surgery, because during that time, the scar tissues undergo sufficient maturation, and once they soften up, it's much easier and better to have the results that we want. Obviously, however, the optimal timing or the method vary from patient to patient. So I think if you're looking to get a revision eye surgery, I strongly recommend that you get consultations from a couple of clinics, a couple of doctors first, have a better idea of what the current state is, and then from that point on, you can decide the next best step for you. So I hope you find this video helpful. Thank you for watching, and please feel free to contact us if you have any further questions. This is Dr. Ko from 01 Plastic Surgery Clinic. Thank you and have a good day.